most immediate. But as you say, the program that we're putting in place is an integrated program with the app, but also with contact tracing driven by testing. So access to testing partly through the app, but also other routes to a test. And then the test result backed up by contact tracing driven by public health professionals. At one level, we've got Public Health England, but also a lot of experience on the ground with directors of public health and local authorities, environmental health officers, who are very expert in this. Exactly as you say, shoe leather epidemiology, out on the streets, finding contacts. But even actually what people call traditional contact tracing isn't very traditional anymore. It's quite highly technical. So we've developed a web-based support, the contact tracing and advisory service, which has been ramped up to support this. And there's also another line of defence through the telephone call centre. So it's a multi-layered approach. And one of the points of the Isle of Wight test pilot is to try and see how those different elements integrate together to support each other. So it's a very good point. We are learning from the best practice around the world, but we also have something to offer in the UK as well, because we've been doing this for a long time.
Thanks, Tom. I hope that answers your question.
Yes, and may I have a quick follow-up question? Are we caught in something of a catch-22 with contact tracing? In that, as I understand it, the numbers of cases have to fall quite a bit more before we can reliably roll it out across the country. But if we keep lockdown measures in place, which we have to until your fifth test is met, it's quite hard to pilot contact tracing because most of us are trying to isolate ourselves as much as possible.
No, is the short answer. The slightly longer answer is that even with social distancing measures, there still are some new cases, and that means that the technology can still be effective. And even with the scale of new cases across the country, contact tracing can still have an impact, and the app will still be highly effective. It's just more effective the fewer the number of new cases. So these are all matters of degree rather than absolute. So we're not caught in a catch-22, but it is absolutely true that the social distancing measures are the thing that is doing having the big impact. And so hence the message remains: stay at home to protect the NHS and save lives, unless you're in the Isle of Wight. But even in the Isle of Wight, you should still stay at home to protect the NHS and save lives. It's that you should also install the app, because that will help this to be yet more effective. One final point on this, which is the Isle of Wight has a slightly lower rate of new COVID infections than some other places in the country, and therefore actually that makes it a good place to test this. Not only is it good because it will help the Isle of Wight, but it is also good because it has that slightly lower number of new infections.
Those lockdown measures until contact tracing is up and running across the country?
No, the two aren't necessarily linked like that. We haven't said that we can't make changes before it's up and running. It's just that the test, track and trace system will help us to get R down and hold R down, and the lower the number of new cases, the more effective it will be. But we haven't made a concrete link that your question drew between the number